Today, we're doing a review. Welcome back to part 3 of the basics of ECG understanding in the world of cardiac CT. Today we're going to look back at what we've covered the last 2 videos, and then we're going to move forward in taking some more advanced steps forward in understanding, especially between the basics of percentage scanning versus millisecond scanning. And I hope today it'll all kind of tie in and help to move, help your understanding in moving forward. So let's dive in, shall we? Again, the basics of cardiac CT editing. This is just a review. We reviewed the P, Q, R, S, and T wave. As we can see, the P, the Q, the R, there's the S and the T wave. We also talked about we need to have quality R tagging from the scanner on each R wave. We also identified that the R wave and the T wave are the 2 most important waves that we must identify in cardiac CT scanning. Each R wave is tagged, and we call this the R to R wave, or the R to R interval per every cycle. In percentage scanning, we covered that the first R wave is always tagged 0%, and the end R wave is tagged 100%. However, then if you're doing a multi-beat scan, which most of you are, in either helically, retrospectively, or prospectively, axial scanning, you're doing a multi-beat scan. If you're doing a single beat scan, you would just use the single R to R, or 0 to 100% if you're in phase scanning. And then each new R wave is tagged 0, and the next wave is tagged the 100% phase. Now, we also covered that there's the ability for millisecond scanning or reconstructing. Millisecond, of course, your first R wave is tagged with a 0 milliseconds because in time and space, that is a 0, always starts off with 0. However, our millisecond end time is based off of the patient's heart rate in that current cardiac cycle. In each cardiac cycle, this is going to vary depending upon the heart rate. Now, if the heart rate stays a solid number across the entire scan, then we know that the timing in milliseconds will be the same, but we can't trust that to always be the case. We also covered that from your R wave to the T wave, in a particular patient, the time is generally set the same from your R to the T, again, R to the T and R to the T in time, that is the same. And that's a very important factor to remember as we will move forward. Now, moving forward, what are we going to add on to these first 2 videos? Well, first of all, I like to recap one more time. It is very important that you know your CT scanner's capabilities. Again, this is a vendor-neutral channel where we're covering cardiac CT starting from a very high view and then diving into specifics as we go along. So it is very important for you to understand and know what your scanner's capabilities are, how to use that scanner, and to reach out to that particular vendor if you need more help and applications training. Now here we have 2 beats, and then I'm showing a very quick beat here, and then a longer beat. It doesn't really matter what the timings of these beats are, but the demonstration here is for you to visually see that if you're scanning in percentage scanning, the percentage is always 0 to 100, and again 0 to 100%. We chunk these down into basically 10% phases, but many scanners can dive that down even deeper into 5s or even 2s or even 1%. For simplicity on this video here today, I have divided this up into 100% or by tens, by every 10%. And so here you can see that in this short beat, you have your your 10, 20, 30, all the way up to 100% phases, and then the same over in this beat. This is obviously an irregular rhythm, where this is a fast beat and this is a slow beat. Now, why does that matter? And this is why we're moving along today. We're going to assume that this is a heartbeat of 80, and we're going to assume that this beat is a heart rate or a heartbeat of 40. Now, don't get caught up in all of the numbers. I put all these numbers on as hypothetical numbers, except for the percentage, obviously, of 0 to 100. And again, we see the percentage. You got 0 to 100, and you have 0 to 100, all with their different phases. Now, if we were to scan, let's say in the 70% diastolic range, you can see here that is indicated by my green lines here. Now, obviously, if you were doing multi-beats, there would be more beats to this scan. However, if we were scanning in the 70% phase, this is where it would fall on the heartbeat of 80, and this is where the 70% would fall on the heartbeat of 40. Notice that it is clearly in two different parts, even though it's the same 70% here and here, that the heart is going to be sitting in a different physiological state within each phase due to the time difference from this R to this R and then this R to this R. Now down below, I've put it into basic milliseconds. So we're going to say that this is 0 milliseconds, of course. That's your first R wave. And in the heartbeat of 80, it's going to end right around the 750 milliseconds. And then this next R is tagged with a 0 milliseconds. And now we see it's coming down to 1400 milliseconds. Well, why is this important? Well, if you were scanning in millisecond scanning, you're going to notice that if I chose a time frame here, and let's pretend this is about 600 milliseconds, 600 milliseconds over here is going to be drastically different than if it was in the 70%. Notice that. And so that is a key thing to keep in mind, that generally millisecond scanning is not good in the diastolic scanning phases, because if you have this heartbeat difference, you're going to have a clear difference on where the radiation is going to be placed within that cardiac cycle. Now you might be saying, hey, but that's okay, I'm going to scan in percentage. So I should be, in all reality, in the same percentage, and then if I put all my percentages together to create my heart, it should look appropriate, correct? Well, not true, because this is such a great beat difference. How it's going to end up looking is something like this. Now, this can happen from a couple of different factors, but in this particular case, although the heart is in the same percentage or phase during the scan on the cardiac cycle in the CT-ECG, the anatomy is not going to be sitting in the exact same place because of the big differences in the heart rates between each beat. And that could end up with an image that looks similar to this, where you're getting this stair-step block effect, because this portion of the heart here would be more related to this 80 beat, and this portion here could be more related to the 40 beat. Therefore, nothing is going to line up in your image. So why is that important? This is good to know that in irregular heartbeats and or very rapid heartbeats, that it is good to scan in a millisecond systolic window. And so the question is, what is the answer to cardiac CT scanning in this type of rhythm? So stay tuned for the next video, because we're going to talk about the reasons why you scan in systolic, either due to a high heart rate and or an irregular rhythm, in both coronary artery scanning and in physiological structural anatomy scanning. So Again, I just wanted to have a quick review today of what we covered in the last two videos, add a little bit more in so you could see just a little bit more of this understanding of why it is so important that we need to know how and where to scan. And in our next video, part 4 of our ECG, basic ECG, understanding for cardiac CT, that you have to be in a certain place and you have to know when and why to do that. Generally, you're going to want to systolic scan if you have an irregular heart rate or a very high heart rate. And I'm going to show you why and all the dimensions in the next video. I know this was short. This was meant to be a quick review. And I hope this is making some sense. And thank you all. Hopefully we're going to get you all there. Until next time, feel free to reach out with any questions you may have.